The phenomena of menstruation is very important for a female to reproduce. So it spans the reproductive capacity of the female starting from menarche till menopause. This phenomena is important for the production of eggs and for the preparation of the womb for the baby. Although cyclic changes are taking place within the body of a female, but this menstruation, the bleeding which occurs every 28 days, it is the only outward and visible sign of reproductive cyclicity in a woman. In the past, the phenomena of menstruation was not very well understood, and there were many misconceptions attached to this phenomena, like it was any bleeding of so much bleeding without any violence was considered unnatural, and it was considered as a morbid condition, a diseased condition. It was associated with evil, and the menstruating female was taken as unholy, unclean, and many social taboos around the world and in different cultures and different religions were associated with menstruation. Like in some cultures, the female was restricted to perform certain household duties like preparing food, like making bread, and like churning the butter, and preparing pickles. And in some religions and in some social areas, in social societies, they were like restricted to visit some holy places like mosque and temples, and was like she was restricted to attend some religious gatherings, and in one place in Nepal, there were special huts, and the menstruating female was shifted to that hut for that period, and the menstruating period was considered as period of shame. So all over the world and different cultures, there were many social taboos attached to this phenomena, and it is poorly understood in in people who are not well aware of this phenomena. The female, in some places, they are not allowed to take bath. They think that it may lead to infertility. As I said, that this is under the control of various hormones, and complex neurohormonal influences are taking place for this menstruation. First of all, I'll briefly describe the physiology of female reproductive system, the anatomy of female reproductive system, and the hormones involved in this phenomena. And then later we will discuss how these hormones, they act upon the female reproductive organs and lead to these biological, physiological, and psychological changes. The female reproductive organs are the uterus, the fallopian tubes, and the ovaries. And the hormones are the one from the brain, the uppermost part of the brain, the hypothalamus. There's a hormone called gonadotrophic releasing hormone. Then there's a small gland, pituitary gland, at the base of the brain. It is a very small gland. It produces two hormones called FSH and LH, follicle stimulating hormone and the luteinizing hormone. And there are three more hormones from the female gonad called the estrogens, the progestrogens, and the androgens. They all work together. I will tell you in a menstrual cycle how they all work together to lead to the phenomena of menstruation. First of all, I'll describe the anatomy of the female gonads. This is the womb, the uterus, right? This is a hollow structure, pear-shaped structure. It is the size of a fist, and it lies in the lower abdominal cavity, and it has strong muscular walls all around and a cavity within it. These muscular walls, it has three parts. The outer part is the serous layer, middle one is the muscular layer, and the innermost layer is the endometrial layer. This endometrial layer, it has again two parts. The one just adjacent to the muscular layer is what we call the basal layer, and this one just near to the cavity, we call it the functional layer. This is the functional layer where all the changes are taking place during a menstrual cycle. this layer, right? This is the layer which is actually sloughing off during the menstruation. And the function of this womb is to receive and to transport the male gamete, the sperms, from the vagina to the fallopian tubes. And number two, it is where the baby grows, and the baby gets attached to this endometrial layer and grows till it is delivered. Second, the other part are the tubes, the fallopian tubes. They are paired structures, thin-walled structures, hollow structures, and these tubes, they have three parts. The one attached to the uterus, to the roof of the uterus, this is the isthmus. The middle one is the infundibular, and this broad part of the fallopian tube is called the fimbrial end. The purpose of this, the function of these tubes are to transport the male gamete from the vagina through the uterus and this isthmus part, the fimbrial part of the tube. Number two, the egg is transported from the ovary through this ephemeral part to this place. Number three, the early fertilization, fertilization and the early growth of the baby takes place in this part of the tube. So basically, this is a very important function performed by the ovary, by the tubes. There's a misconception that the initial fertilization takes place here, but not. The fertilization takes place here. The initial development of the baby begins here, and it takes about 5 days to travel from here till the actual destination of the baby. The initial development takes place in the tube. Then are the female gonads, called the ovaries, and these are also paired structures, two ovaries, and they are almond-shaped structures. And the purpose of these, the ovaries, they produce eggs. Actually, every female child is born with her total package of eggs when her mother is about 6 to 8 weeks pregnant with her. So she gets her total package of eggs when she's not even born. And after the birth, she starts losing her eggs. So by the time she is 12, 13 years of age, she has only 2 to 3 million of eggs left, although she had about 4 to 5 million of eggs when she was intrauterine, when she was in her mother's womb. So the function of these ovaries is the production of the female gametes, the eggs, and production of two hormones, the progesterone and the estrogen, which are very important in the phenomena of menstruation and in the early development of the baby. So these were the female gonads, and then next is the hormones we were discussing. This is the hypothalamus. There's a hormone called the gonadotrophic releasing hormones, GnRH. It is secreted by the hypothalamus. It acts on this small gland called the pituitary gland, which in response to this GnRH hormone, it produces two hormones called the follicle stimulating hormone and the luteinizing hormone, right? These two hormones, they act on the female gonads, the ovaries, and it initiates these hormones. In response to these hormones, the ovaries start making the eggs, and the eggs then produces in the initial part of we'll discuss this in the menstrual cycle, how these hormones work together to make the eggs and then to prepare the lining of the uterus. So the purpose of these ovaries are to produce estrogen and progesterone in different phases of the menstrual cycle in response to the hormones from the brain. So this was all about the hormones and the uterus and the female reproductive organs. And now we'll discuss in a menstrual cycle how these hormones work together to produce the events and the biological, physiological changes that takes place in a menstrual cycle. Menstrual cycle, it is the interval between two successive menstruations. As I said, that menstrual cycle, the average length of a menstrual cycle is 28 days. It starts the first day of menses, the first day of the blood flow is the first day of the cycle, and the last day is the 28th day is the first day of the next menstrual cycle. So the length of the menstrual cycle on an average is 28 days, but it can be plus minus 7 days. It can be as short as 21 days, and it can be as long as 45 days. So it can vary from women to women, and we will see how this also affects the fertile time in a female. On an average, the fertile time is considered the day 14 of a 28-day cycle. But when the cycle is prolonged, or when the cycle is like short, the fertile time can change according to the length of the menstrual cycle. It is not fixed for every woman. It can vary to women according to her menstrual cycle. Menstrual cycle comprises of changes that taking place in the ovaries and the changes that are taking place in the uterus. So the ovarian cycle and the endometrial cycle. This is a very good diagram to understand the menstrual cycle. We will see the changes, we will see how these hormones, they are working on the ovaries and the uterus to prepare to produce the eggs and to prepare the bed for the baby. So starting from here, pituitary, from the brain, hypothalamus and the pituitary, it produces two hormones, FSH and LH, but they are produced in different phases of the menstrual cycle. In the ovaries, the changes are taking place in 3 phases. In the ovarian cycle, there are 3 phases. The first phase is the follicular phase. The second phase is the ovulatory phase. And the third phase is the luteal phase. There are 3 phases. In the ovary, there are 3 phases, which corresponds to the changes in the endometrium, and the similar phases we have but different names, like in the endometrium, the lining of the bed I was talking about, that the endometrial, the functional layer of this is the functional layer of the womb, and the changes that are taking place in the functional layer of the womb is the first 5 days. This is where when the bleeding is taking place. This is the menstrual phase, which corresponds to the follicular phase of the ovary. Then second is this one is the follicular phase. Starting from after 5 days of bleeding, then is the follicular phase. And then after 14 days, this is the secretory phase, which corresponds to the luteal phase of the ovaries. So in simple words, I'll explain you what happens in a menstrual cycle, that from the brain, the gonadotrophin hormones is released from the first day of the menstruation, and it stimulates the pituitary gland to produce this follicle stimulating hormone. You can see the graph. From the first day of menses, this is coming from the pituitary gland, the follicle stimulating hormone, and its level is rising. So the purpose of this follicle stimulating hormone is to act on the ovary to make the follicle. What is follicle? Follicle is actually a fluid-filled sac which contains the egg. Every month about 100 to 200 eggs start growing in an ovary on an average, 100 to 200 eggs, but only one egg gets mature. So this is the in the ovary, there are like 100 to 200 eggs, they start growing, but only one gets mature, and here we are only discussing this one egg which gets mature. So in response to this follicle stimulating hormone, the ovaries begin to make eggs, and this fluid filled cavity, you can see the egg is here within it, and there is a fluid collection around this egg. This is the egg, and there's a fluid collection. This we call it follicle. This is the follicle. So in response to the follicle stimulating hormone, the follicle begins to grow, and only one of the eggs grows, and the rest of them, they die. So as the follicle grows, there is a fluid collection, and the egg inside it gets mature. This is the first 5 days of menses, and this corresponds to the follicular growth in the ovary. As the eggs are growing, there is production of hormone from this follicle, which is called estrogen. So you see, as this FSH level is increasing, the follicles are growing, and the estrogen is produced from this follicle. The level of estrogen is also increasing. This estrogen acts upon the bed of the uterus and it makes it more vascular, more spongy and thickened to prepare it for the baby, to receive the baby and to lead to implantation. So this estrogen is also increasing because it is coming from the follicle, and this estrogen is acting on the uterus and preparing it for the baby. So what happens in a 28-day cycle, on day 14, what happens, there's a lot of pressure inside this follicle, lot of fluid. So what happens, this follicle ruptures and it releases the egg. So egg is released, this is what we call the ovulation. So at the time of ovulation, what happens, that this follicle stimulating hormone is coming from the brain. So this is initiating the follicular growth. So when the follicle is ready, mature, the level of FSH drops because now FSH is no more needed because the follicle is ready. So when the follicle stimulating hormones level is dropped, the estrogen level is high. When the estrogen high, brain gets a message that now the follicle is ready, so there's no need of FSH. So what happens, this high level of estrogen, it gives a feedback mechanism. It has a feedback mechanism and it sends message to the brain to stop this follicle stimulating hormone because it's no more needed, and to release another hormone called the luteinizing hormone. This, you can see the luteinizing hormone, and this luteinizing hormone, it leads to rupture of this follicle. And the egg is released from the ovary. So now when the egg is released from the ovary, it goes into through the femoral end of the tube, it goes to the tube, and if it gets the sperm there, it gets fertilized, so what happens, this empty follicle, it starts producing, or even if it doesn't get the sperm, what happens, this empty follicle, it starts producing another hormone called the progesterone. The purpose of this progesterone hormone is to make this bed more spongy, more vascular for the baby to come and embed into this bed. So what happens, this corpus luteum, it is producing progesterone. After some time, if she gets pregnant, this corpus luteum will continue producing this progesterone and the bed will become spongy. But if the fertilization doesn't place, if she is not pregnant, this corpus luteum will die and there will be no more progesterone then, and the next menstrual cycle will begin. Menarche, as I said, it is the first menstrual cycle in a female. Around 12 to 13 years of age, there's a transient change in a female child, from childhood to womanhood, and it takes about 2 to 3 years, what is called puberty. And the menarche, the first menstrual flow, is usually the last one to occur. The first three are like the first changes usually takes place when we call it thelarche, then adrenarche, and then the last one is menarche. So menarche is the first menstrual flow in a girl, and it is the last one. Before the actual menarche, the female has the little changes. She has gained the weight. She has become tall, and a last one to occur is the menarche. The menstrual cycle begins is the last part of puberty which takes place. Signals the possibility of fertility. As I said, the menstrual cycle is essential for a woman to reproduce. So when she starts her menstrual cycles at menarche, now she has the potential to become a mother. So it signals the possibility of fertility. So the fertility span is from menarche till menopause. Before that, she has reserves of eggs, but the hormones in the body, they are not sufficient enough to mature the eggs and lead to menstruation. So this menarche, the first menstrual cycle, is brought about by a gradual transition of hormonal secretions from the pattern characteristic of childhood to that of adulthood. At the time of menarche can be like the average age is 12 to 13 years, but it can be as early as 9 years and it can be as late as 16 years. So when it is early, we call it precocious puberty, and when it is delayed, we call it simple delayed puberty, which is around 16 years of age. So the changes that take place in a female, a girl, at the time of menarche are, there are certain somatic features which take place, her physical appearance changes, secondary sex characteristics develop, there's deposition of fat around like buttocks, chest, and there's a linear growth spurt, she gains weight, height and weight, and then like what I said, there's a deposition of fat, so her body structure changes from a child to a woman, and their appearance of pubic and axillary hair, and there's increased pigmentation of skin and acne. Some girls may develop like small pimples on her face. So these are the somatic features which occurs at the time of menarche. In addition to these somatic features, lot of psychological changes take place at the time of puberty, because it is a very central event in a female's life. In a girl's life, it is very central event, and it is very important, because previously, I remember the mothers used to get very depressed when her daughter starts her menstrual cycle, but now I think with so much problems, and I think we must think that it is a very important phenomenon, and it is a very, like without it, a girl cannot become pregnant, and it is for her fertility and for her life, it is very important. The psychological changes which take place at the time of menarche are, she gets mature, lot of mood swings, she may become happy, irritable, and self-conscious, shy, she will like to dress up, and social withdrawal. Some girls with the onset of menstruation, they become very shy, and they socially withdraw them from the rest of the family. So these are the psychological changes that are taking place at the time of menarche. Onset of menarche, as I said, average age is 12 to 13 years, but can be like as early as 9 years, and can be late as late as 16 years. But if it is like delayed by more than 16 years, it is the time that the mother should take her to the doctor, because sometimes some conditions can be treated if the periods are delayed. If there is a deficiency of hormones, the hormone replacement therapy can be given to the girl if the puberty is delayed. But certain conditions, of course, we cannot, where there is a genetic like absence of the female reproductive system, then nothing can be done. But there are certain conditions where there is hormone deficiency, the hormones can be given to the female, and her menstrual cycles can be initiated. Factors that affect the onset of menarche is genetics, usually nutrition, general health, psychosocial. If the girl is starving, she's thin, her menstrual cycle will be delayed. So nutrition, genetics, and psychosocial factors, they affect the onset of menarche. Menstrual disorders. Usually, as I said, menstrual cycle is like 28 days plus minus 7 days. The flow menstrual flow lasts for about from 3 to 7 days on an average, and there are some symptoms, psychological and physiological changes that take place during a menstrual cycle. But sometimes there are some menstrual disorders can occur in terms of the length of the menstrual cycle, in terms of the flow can become heavy, and the symptoms related to the menstruation can be exaggerated in some cases. We'll discuss few of them here, more important. Amenorrhea. Amenorrhea, we call it when there is complete absence of menstrual cycle. Amenorrhea can be physiological. Physiological means when there is no problem, no disease, and sometimes it is like pathological. Pathological means when it is associated with some disease. Physiological amenorrhea is before puberty, there is no menstrual cycle. During pregnancy, there's no menstruation. Lactation is like breastfeeding. Some women do not have menstrual cycles during lactation, which is also again due to a hormone called the prolactin hormone, which is very high during lactation. So this prolactin hormone, it leads to amenorrhea. Then menopause, that is after her periods are, menstrual cycles have finished, after 50 years of age, there's no menstrual cycle. So these are the physiological amenorrheas. There are two types of pathological amenorrhea. Primary amenorrhea is when she never started her period. Never. No puberty, no menarche, nothing. So this is primary amenorrhea, when she never had periods, which are usually due to some chromosomal abnormalities and where there are no reproductive organs, genetic. So this is the primary. Nothing can be done in this condition, in this state. Secondary amenorrhea is due to some disease process like psychological factors, like stress, starvation, psychosis. Sometimes it may be hormonal. Thyroid hormone is a very important hormone in the body. It may lead to amenorrhea, no periods, if the thyroid is not functioning properly, the low thyroid hormone, it may lead to amenorrhea. Hyperprolactinemias, it is, as I said, it is a prolactin hormone, which is, if it is in excess in the body, it may lead to amenorrhea. And there's a gland called adrenal gland lying near the kidneys. It may also hyperadrenalism, when there's a more adrenaline hormone in the body, it may lead to amenorrhea. Then there are certain pathological conditions in the ovaries, the female gonads, which may lead to amenorrhea. Ovarian failure can be like primary, when at birth the ovaries are not functioning, or there are no eggs. By birth, the size of the ovaries are good, but there are no, genetically she didn't get the reserves of eggs. And sometimes the ovaries are removed due to cyst or something. So when there are no hormones, when there are no ovaries, no eggs, when there's no egg, there is no estrogen, because estrogen is the hormone which prepares the bed. So when there's no estrogen, the bed is not prepared for in the uterus, and there is no bleeding, so no menstruation. Then one very, very common problem these days, polycystic ovarian disease. It is a very common problem. About 30 to 40% of our girls are having this problem, polycystic ovaries. Every third, fourth girl is having this. And the symptoms are like weight gain, there's hair growth on the chest, chin. The menstrual cycles are irregular, 2 to 3 months, 4 months. If she's having irregular menstrual cycle, sometimes if she gains lot of weight, she may not have period for an year or two, and sometimes no periods without medication. So this is a very common problem these days, and 10 to 15% of girls may have infertility with it, because, as I said, menstrual cycle is very important for fertility, for the production of eggs, and the preparation of bed. So when she will not have any periods, of course she'll not get pregnant. So this is a very common problem, polycystic ovarian disease, and I want everybody to know it, because the treatment is just to lose weight, nothing, no medication, just to maintain her weight, and starting maintaining her weight from the time of menarche. It is very important. Treatment is just to lose weight. It is very common.